In this video, I'm going to show you a way to move the patella around in a full range of motion that is controlled. Now, you can try to do this with your knee slightly bent or completely locked out. The most important thing that you need to understand is that you have to let everything relax in the leg. If you have any sort of tension within the muscle, the kneecap's not going to want to budge. In general, I think the kneecap is a pretty scary thing to actually move around, and how scary is it when someone actually sits on your leg, maybe on your knee. So it's a very protective area because we understand that this knee, of course, flexes. In terms of extension, we do not want to hyperextend it. Of course, there is a bit of rotational movement within the knee. But anyway, we want to move the kneecap around. All kneecaps are going to look completely different. So if my kneecap looks different than yours, don't worry about it. You're just going to use the kneecap that you have. So what I like to do is, give a little bit of sensory stimulation to the entire kneecap and around, and just give myself a little bit of awareness to the kneecap. And everyone's going to have a different kneecap, as I mentioned. So you want to start off first by isolating where exactly is the kneecap. So there's going to be the height of my kneecap, and there's going to be the width of my kneecap. So I like to start at the top. I like to use my thumbs. I like to really relax my leg, and I like to pull the skin back and then get kind of underneath the edge of the kneecap and sort of push it forward. Sometimes takes a couple tries just to get comfortable, and there we go. I can push it forward a little bit. Just push it forward. Push it forward. So I just want to feel good about the fact that I can push it forward. Next, I'm going to try to actually bring the kneecap back. A little bit easier to bring it back. So I've got backwards, push it forward, back. Then I'm actually going to try to push it over to the side. I'm going to come to the medial side, the inside of my kneecap, and push it out. So there you see it actually moves quite well in that position, moving out to the side. Next, I'll go from the lateral side and I'll push it inwards. There we go. I'm pushing slightly down and over. I can really feel that kneecap moving immediately, okay, to the inside. So now that I've established that I can move my kneecap forward and back and side to side, now I'm going to attempt to do actually a complete circle with the kneecap. So I'm just going to lightly push the kneecap forward, over, pull it back, around, inside, forward. So I'm definitely moving around in a small circle. I can feel some popping and cracking under there. I can even heard something. Doesn't matter. It's called crepitus. Lots of body parts and tissues that pop and crack. It's just as long as it's not accompanied by pain. I'm also making sure I'm breathing and trying to stay relaxed. Next, I'm actually going to go the other direction. So I want circles in both directions. I feel like I can actually get it to move right around quite good. Excellent. And that's it. I'm going to go back to my squatting and see how that feels. So go ahead, give that a try.